Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Doxepin. Its brand name is Silenor. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Doxepin works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Doxepin. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Doxepin work? Well, its antidepressant effect is believed to be partly due to its influence on the adrenergic activity at the synapses, where it prevents norepinephrine deactivation through reuptake into nerve terminals. Its antipyretic effect is due to potent H1 and H2 receptor blocking action. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in the treatment of anxiety or depression. It can be used in the treatment of insomnia, as well as for moderate pruritus or itchiness. This medication can also be used specifically for anxiety and depression associated with alcoholism. With respect to contraindications or reasons we would not be able to prescribe Doxepin, we wouldn't give this medication to a patient who had a hypersensitivity to Doxepin or any other component of the formulation. Patients with untreated narrow-angle glaucoma should not use this medication, as well as patients who have severe urinary retention. Patients who have used a monoamine oxidase inhibitor in the previous 14 days should also not use Doxepin. Note about dosing with Doxepin. So in the treatment of anxiety and depression in alcoholism, the initial dose would typically be 75 milligrams per day orally for moderate to severe illness. If the illness was more mild, they may be treated with 25 to 50 milligrams per day. They would have the option to increase their dose gradually to 300 milligrams daily with more severe illness. The usual dosage range would be 75 to 150 milligrams per day orally as a single dose or given in divided doses. And the maximum dose would usually be 150 milligrams per day if they were on a once daily schedule. In the treatment of insomnia, and the patient is under 65 years old, we would typically see 6 milligrams orally once daily within 30 minutes before bedtime. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Doxepin. I'll go over some of those here now. 4% of patients may experience constipation, while nausea seems to happen about 2% of the time. Xerostomia or dry mouth may happen 15% of the time, and up to 10% of patients may experience dizziness. 6 to 9% may experience somnolence, and some patients may also experience urinary retention. 2 to 4% of patients may experience an upper respiratory infection. Now, some more rare but serious side effects would be hypotension or low blood pressure, suicidal thoughts, or a granulocytosis. That's all we're going to talk about today with Doxepin or Silenor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.